strong policy that can actually help with management of sickle cell anemia.
Okay. Dr. Makore, she's mentioned that, you know, when one goes to hospital, there's no clear guidelines. But I know from training, there's a clear set way of how you diagnose sickle cell and how you manage it. So we'll start from how does one get a diagnosis of sickle cell?
There are different ways of getting a diagnosis of sickle cell. But in our setup, as she says, most of the patients get diagnosed after they get the first complication. We don't have, like in some places, usually the ideal would be to, by the time you're having your child, you should know if it is a carrier or a sickler you're going to have, so that the management can be taken over from birth. In some countries, they have routine screening of newborns. We hope that is where we reach, even some African countries. But here in Kenya, what we are doing, we usually wait for the first complication. Maybe the child gets anemia very often, or infections, or they are not growing as fast as they should, like other children. Then we started now investigating. And the common investigation is just an examination of the blood cells, the morphology, looking at the shape of the red blood cells under the microscope. That alone can give you an idea that you're dealing with sickle cell. Actually, once we see that, we start treatment. Then there are other tests to confirm. These other tests for confirmation are the ones that are not available. Even here in Kenya, as we talk, there are very few centers that can do HB electrophoresis, for example. Yeah.
Okay. And now, when parents present with the complications, how bad is it usually by the time they are coming and already the child is complicating, they've been suffering from frequent bouts of anemia, or they're in pain? How bad is it usually? Can they be reversed back?
Yes, because the disease, as much as there will be sicklers in a group of children, the severity of the disease will be different from one child to another. So once they start getting complications, these complications will be different. Some will come with anemia, they don't have enough blood in their body. Others will come in painful crisis. Others may present with severe infection. So once you treat now the underlying cause that has led to that crisis, usually the child goes back. But you understand, when they are coming from settings where these complications have been happening repeatedly, it may be difficult because some of the damages cannot be reversed. Like in case of sickle cell, the complication we fear the most are the strokes. When you get cerebral hemorrhages, and such complications are better prevented